everyone, I'm Dr. Hemi Soneja. I'm a consultant in diabetes and obesity medicine at Swastik Diabetes and Metabolic Center and JP Hospital, Noida. Early age with a stroke, heart attack, problems like nerve damage, problems like foot amputation, also kidney failure and kidney disease related to diabetes. In addition to these, there are other problems like diabetic retinopathy, which specifically means that the retina of the eye gets affected due to diabetes over a long period of time. Minimum frequency of checking for people who have problems with diabetes, which is very well controlled and they're only taking medications by mouth, would be at least once a month. And again, people who are on insulin, they might need to check their sugars anywhere between once a day to 4 or 5 times a day, depending on the kind of insulin they are on. If your blood sugars are more than 400, one thing which you should not do is exercise at that point of time. Consult your doctor and get your medications adjusted appropriately. Now, talking about low blood sugars, that's a totally different thing altogether. It can be an acute problem, meaning that people are having problems with sudden shivering, shakiness, feeling faint or dizzy. Things like these need to be addressed immediately at that point of time. So the first thing to do would be to get hold of any kind of sugary thing, say for example a fruit juice at home. If it still continues to be low, I would recommend going to the emergency department, because at times people might need infusion through the vein for some extra sugar. A lot of important things in diet which can make a lot of big differences in the way your blood sugar levels are being controlled over a long period of time. So in addition to blood sugar control, it also helps maintaining your weight at a reasonable level, and also in people who are overweight, it helps them reduce their weight also. Exercise is as potent as a medicine for diabetes control. Diabetes in children is becoming very common. There used to be a time when in kids it used to be only type 1 diabetes, which is also called as insulin dependent diabetes. But now we are actually seeing a lot of increasing incidence of type 2 diabetes. Don't stop your medications without talking to your doctors.